This is a Two Front podcast.
You got a crooked smile, well that don't bother me much. You double over, working double time, you double tough. I'll just shine it up until the sun hit like a glare. I gotta dare, get the fuck up out the chair.
Iranian immigrant and founder of Columbia Dental Group in Connecticut, Dr. Abbas Mohammadi has gone public on LinkedIn with exposing massive insurance fraud, revealing that AI is denying legitimate claims that prevent dentists from getting paid for their work. He publicly fights insurance companies, exposing the Americans denied access to care and dentists being able to get paid for their work, despite a $500 billion Medicaid budget. While insurance CEOs make millions and patients can't afford $40 copays. His LinkedIn crusade reveals how insurance companies weaponize regulations against honest providers. Those who know me know that I love a revolutionary. Dr. Abbas Mohammadi, welcome to The Happy Dentist.
Good morning. How are you?
I'm really good, and I'm really excited about this episode today. I'll tell you, this is something that's near and dear to my heart because my dad, as a neurologist, has been telling me for years how messed up the Medicaid system is. Specifically, in his instance, first of all, there's a neurology shortage in the country. He's one of the only neurologists that not only takes pediatrics, kids, he takes pediatrics with Medicaid. And the reason this is such a big deal, as I'm sure you know, as I'm kind of talking about this, is that neurologists who take Medicaid are preyed on by these racks, or I think they're called something auditory recovery. They're trying to recover money from neurologists who take Medicaid. And so I've been hearing about this for a really long time. And when I found you on LinkedIn, I thought, oh my God, you are spreading the gospel for the dental industry, who I know is experiencing very similar things to neurology. So I'm really excited to dig in with you today and just hear your story about what happened and share with our listeners what's going on with the dental industry, with Cigna, so that we can share your mission and spread awareness.
Thank you for giving me this opportunity to talk to your podcast. Yes, you're correct. I'm not the only one. You have the experience with your father as well. This is a systemic issue. This is not the isolated issue. I just happen I'd be like a outspoken and bring it to the LinkedIn and social media, but I'm not the only one. We see on every single day denial by the insurance company, and for reasons that I don't comprehend. Is reasons like the dental history says that, oh, you don't need to have a crown, for example. I don't understand. I don't comprehend what does mean. Obviously, when the patient read that EOB, the first thing they came to their mind, oh, you did something wrong. They don't believe
Mm.
that. Always the provider is the one that the narrative is such a way, and they create the narrative. Both Medicaid program and both insurance industry, they already created the narrative that the provider is in fault. Provider
Mm.
is the one that committing the fraud. So when the patient receive that EOB, say, oh, you guys charged me $500. I didn't even need to have a crown. Or it says that they are shows that there is not 50% destruction of the tooth and two-dimension radiograph. And again, even based on my own calculation, when I see the radiograph, I see, oh, there is a way more destruction of the tooth, more than 50%. But because the AI, it says that, oh, there is a less than 50% destruction of the tooth. As the result, you don't need to do the crown.
The
And the
AI.
exactly. And the problem it happened that they send this EOB to the patient. They put in their head that, oh, they didn't need to do it. You should have to do it a feeling instead of the crown. And the patient, they call the office. They get very upset. They talk to front desk. Obviously, they not doctor, they not clinician. Then they make upset the patient. It's not just the money. It's just these insurance company, including even Medicaid. They trying to put wedges between the patients and the provider. For
It's actually
example,
criminal. It's actually criminal. Like, it's if I were to summarize what you're saying is that we have all these healthcare providers all over the country who accept Medicaid, who are diagnosing usually accurately, I would assume, considering that all healthcare providers take the ethics exams. And now we have insurance companies that are using AI to contradict American doctors, therefore putting patients and doctors at odds with each other, right? That's
correct,
it's
correct.
core to our industry. Dr. Abbas, I would like to ask you some very specific questions. I actually have a lot of questions for you here. So I want to make sure that we share with your listeners if that works for you.
Sure.
Okay. So you talk a lot on LinkedIn about what's going on in the dental industry, right? So, a patient uploaded photos that didn't even show her painful tooth. The AI gave her a perfect health score of 100. And then a dentist prescribed 3 medications in a 3-minute video call. How's this legal?
I don't think that that's legal, but definitely unethical, and unscientific. I mean, I'm not attorney, I'm not a lawyer, but I don't think this is a legal things to do. And on the top of it, they charge like $49 for that visit. Okay. And in the EOB with each, which I also posted on the LinkedIn, there is no ADA code been associated with
Mm,
with that EOB. Imagine I submit a claim and I just oral exam, folk limited oral exam without putting the ADA code. They're not going to pay for that, okay? But they don't didn't even use the ADA code, okay? And that was a mutual patients that
mm,
called, and those patients, they have a insurance in Connecticut because Cigna has a contract with the state of the Connecticut. They call it Cigna Enhanced Program. So Cigna Enhanced Program, most of majority of the state employee in Connecticut, they have a Cigna Enhanced, and they not even paying because I'm out of network in my Manchester location and I'm open 7 days a week. I see a lot of emergency patients, including Cigna Enhanced. But Cigna Enhanced does not have, they pay just the very 10% of my fee out of network. So
mm,
these patients, they get forced to use these virtual services, because if they come to me, they have to pay for the services because their insurance doesn't cover for it. So in order to cover up their butts, they came and create this bizarre system, and the doctor prescribes augmentin, not seeing even the patient, not having even a radiograph. Is bizarre.
And what's so yeah, I did read a lot about what you were talking about with these virtual platforms that are, in theory meant to support these patients who aren't able to afford, but the virtual platform, like you mentioned, use no official dental codes, but got paid instantly.
Yeah.
Meanwhile, real dentists are using proper codes and get denied. So what does this tell you?
That's tell me fraud, fraud interface. This is basically is fraud, but unfortunately nobody does anything about it. It's an open
Mm.
fraud. Is there is a paper trail of it, but everybody for whatever reason wants to put a blind eye on it.
Mm, yeah, this is something that I talk about with my dad a lot. What is it going to take for doctors and patients to get quality care when, the truth is that we have money and power against doctors and patients getting the highest quality care. Another thing you mentioned is that this virtual dentist prescribed antibiotics, augmentin, surgical rinse, and numbing gel. without ever actually seeing the tooth. Would you take medication prescribed by someone who's never examined you?
Absolutely not. And even the medication is contradictory. What lidocaine gel is going to do if the patient has odontogenic infections? It's just what they're going to numb the oral mucosa. So what the patient has a, if they say that diagnosis is correct and the doctor believe that the patient has a odontogenic infections, why prescribe the lidocaine? I mean, what
Mm.
effect is it? And then Listerine, I don't know, Listerine, Peridax or Chlorhexidine mouthwash. What? Okay, I mean, we use that if the patient has a surgery, cannot brush after the surgery to kill the pathogen superficially. But if the patient has the infections within the alveolar bone, how perioguard is going to reach to that infections. So these are over medication, is abuse the system, is harm to the patient, inflate the profit for pharmaceutical company, doesn't have no benefit for nobody.
Hmm.
That's why this country has such a huge budget on a healthcare, and I've seen it on a daily basis. But the people, they don't have uh, uh, access to the healthcare.
And tell me, Doc, you mentioned that Cigna CEO makes $20 million a year, while patients can't afford a $40 down payment for emergency dental care. So help me connect those dots.
How could I connect that out? I mean, there is obviously is a huge this connection between the industry, and that CEO goes online and social media, does the community services, that, but what the meaning of that is, they make such a big profit, and their own patients, they refer them to virtual care instead of paying doctor or provider like me, that they are open 7 days a week to
Mm.
provide the real care to the patient.
It's really capitalism gone wrong. Like as you're saying, this virtual care is prescribing medication that isn't going to make a difference for that patient who unfortunately is suffering. And there's doctors like you who could help this patient. And this healthcare system is trying to make it more efficient by eliminating doctors when they could figure out a way to get patients reimbursed. You know that sinking feeling when the same patient keeps coming back for crown after crown? Yeah, we've all been there. Here's the thing: what if we could actually prevent all that mess with a simple bite correction? That's where we come in at Two Front. We handle the whole Invisalign process for you. I'm talking zero ClinChecks, zero lab bills, barely any chair time. Oh, and we take on the liability too. Your patient gets a healthy bite that'll save them thousands down the road. You get to be the hero who prevented years of dental drama. It's honestly a no brainer. Check out Two Front and start helping your patients dodge a lifetime of dental work today. One thing you spoke about is that you said that United Healthcare sat on a Medicare claim for 14 months and then denied it, saying it was the wrong code. That's taxpayer money that they're playing games with. How is this not fraud?
Yeah, again, I don't know. Okay, I really, it is fraud. Okay, 14 months. They said the wrong code, and then guess what? When we said that, I sent a letter directly to the United Healthcare. I said, no, this is not a wrong code. This the radio shows, the panoramic shows that has amount of the bone and the distal of that tooth. So this is a proper code. After that, you know what they changed? They didn't say it is a wrong code. They said, oh, you should send it to the medical insurance. After, yes, that was the response to it. After 14 months, they said, oh, you're sending to the wrong insurance company. This is
Oh
a
my God.
medical code. You need to, is a ADA code for it. They have it in their own a manual that they pay for it, And then after 14 months, they telling me, no, you have submitted to the medical insurance. And submitting to medical insurance is a totally different industry, totally different billing process. A lot of people, even in my billing department, are not trained to submit to the medical insurance.
Of
So,
course.
yeah, they throw wrench on your road left and right, any reason to not just pay.
I think the living in America is such a privilege, right? Because there's where are you from originally?
I'm Iranian. I'm from
Iranian. So
Iran.
so you're from Iran. My family is basically half from El Salvador and half from Palestine, from Bethlehem. And so
Oh,
we all know that, it's better to be in America than it is in any of our three countries, right?
absolutely.
We have
Yes.
more rights. However, I think what really we need to be talking about to make this country even better is how do
Correct.
we make the American health system better? Because education and healthcare are core foundational rights that we need as a company so that we can compete against other rising companies, right? So I want to talk about some of this corruption that you've exposed. You documented state officials dropping investigations for well-connected doctors while targeting others. How deep do you think this corruption goes?
It is well corrupted. They already same people. They already under indictment by federal government for another doctor, Dr. Helen Zerwas, that they dropped their Medicaid fraud because she had connection with the state representative and somebody else. They took the bribe to drop the Medicaid audit. So
Mm,
this is the way they weaponizing at least in Connecticut Department of Social Services. They weaponizing to selectively targeting certain doctor, and they let other doctor to get away with the murder based on their connection and so on. So they control also the competition within the society. Let me tell you, because my business model really challenged the status quo in Connecticut. I was the first one that opened 7 days a week. I was the
mm,
one that it brought multi-specialty practice, so there were no need of external referral. So my business model challenged the status quo, something that of course is good for the public, for the patient, but a lot of my colleague did not like my business model. And
mm,
unfortunately, based on the connection that they have with the governmental agency, they are using the Medicaid program to weaponize and target people that they want to target, and they wanted and they drop the audit on the doctor that selectively they are well connected. So this is
mm,
again is another example of it. But let me just get sidetracked from what I didn't know about your background, that you from Salvador or Palestine or whatever. And I wanted to add all those stuff that I am criticizing about the policies in state of the Connecticut or with the insurance company. But at the end of the day, yes, uh, still America is the best country in the world. Is the democracy there? It's not like we don't like where we are and we landed. I love my hometown, my adopted country, but I think America deserve way better. American people deserve way better. So all our critics that I put on my LinkedIn and I'm talking to you is not is anti-American. Actually, those are pro-American. I want America to be a better place.
And that's something I super, super respect about you, and that's why I'm so excited to have you on here as a guest because, yes, I agree with you. I think being born in America is the biggest privilege anyone could ever have, but to your point, there's so many things that need to be better, and I mean, for me at least, it's the food system, it's regulation and healthcare, and it's the education system. We need to create more opportunities with for people here in the United States. So, Doc, I wanna ask you a couple more questions. So you said that there was a woman with an abscessed tooth who couldn't get care because she didn't have $40 on her debit card. Meanwhile, as we all know, insurance executives make millions. Do you have any idea how we got here and what we can do about it?
Well, the problem is all it become to the corruption, and it all becomes of the connection. For example, I know David Cordani talking about the insurance company and Cigna. He's from Connecticut. He's well
Mm,
connected. Okay, he's a well connected person, and he get contract with the state and inflate his profit. So unfortunately, our regulatory agencies, um, not always, but there are many pockets within our regulatory agencies that they are corrupted. They already know about those things, but they don't do anything about it. You know what I mean?
mm, yep,
Let's say if I would do something like this, that I'll take the picture and build the insurance company. Believe me, DPH, Department of Social Services, AG, attorney offices, all the agency, they come after me. I can tell you they would be be on my door next day. You see what I mean? So
totally.
that's the problem. You see what I mean? They
Mm,
they keep the provider in a totally different standard, which is good. I'm not saying that not to be a regulatory and the provider, of course, has to be there.
mm,
Everybody has to be play and it be a fair game. They
mm.
have a standard on the insurance company. They can do whatever they wanted to do. Nobody say nothing to them. But for God's sake, one provider does fraction of the stuff that the insurance company does. Everybody after. You see what I mean?
Mm,
So, discriminatory, they are enforcing the law and selective enforcement. I think that's the issue. That's we got one person doesn't have $40 and the other person make millions of dollars every year.
I mean, it's mic drop. Like, that is the issue here in our country, and I think we need to just make it the reason that I think this podcast is so important is because I really appreciate all of your posts that you write on LinkedIn, and I think that if you're able to share this through video, it's going to reach the right people. I truly believe that that's the power of social media, is that this little clip can reach people and help you reach other doctors who can connect and make change in this country for the betterment of America. So, one thing you mentioned is that insurance companies won't tell you what they pay out of network dentists. It's like going to a restaurant with no prices on the menu. Talk to me about how this is legal. How do they justify this?
I don't know. I was shocked. Okay. I was shocked because, when we drop the insurance company in my Manchester location because we didn't want it to participate with their fees. It came, sometimes we did the cleaning out of $400. Sometimes they pay $160. Sometimes they pay $80. And the number was, sometimes at least you know what to tell your patient. Oh, okay, they pay only 50% of your cleaning because we are out of network. Sometimes they pay, we contact both Cigna rep, we call both United Healthcare. I talk to them, we send them an email, and they send us, oh, we do not provide out of network benefit. So my patient comes. And still, for example, patient they come with Cigna enhanced on weekend, or patient they come on United Healthcare and they are in pain agony. I said, okay, I could. You have to pay your fee, and then I submitted to the insurance company because I don't have no idea how much. Your insurance company they is going to pay. As the result, what happened? Patient they live with the pain, with the infections, they end up to go to the hospital. That is going to cost even way more the healthcare system, because hospital is not equipped to treat the infectious, the odontogenic infections, or they're not doing anything for them. They just again give them antibiotic physician on the emergency rooms. But unfortunately, that's the system. It is spending a lot of money and is still they not getting services. My phone ringing out of the hook every day. Patients that they are on Medicaid and they are looking for a services. Oh, do you accept Medicaid? No, I'm sorry. Do you know anybody that accept Medicaid? No, I'm sorry. And the budget of the Medicaid in a state of Connecticut, and Connecticut is a very small state, is more than $10 billion. Okay.
What?
Yeah. The budget of the Medicaid in Connecticut is $10.2 billion. Okay,
Just in Connecticut.
just in Connecticut. Okay. And those are federal money that they come to the Connecticut. And people like Dr. Gifford are sitting on that money. And with all those corruption, who knows where that money goes? It goes all through these inefficiency. And the patients, I have Medicaid patients all along, they forced to come to me, and they remove the tooth, get them out of the pain. They get the uncle to help them with the care credit or with charity or whatever. With these poor people, and they have Medicaid, and they cannot receive a care from an organization with $10.2 billion budget. This is insane.
So if we just do the quick math, however many, so we're doing, we're talking about at least a $500 billion budget for Medicaid for patients to get the healthcare that they need, especially from their dentist who has, they're coming to see you. Unfortunately, once they're in a lot of pain because they're not regularly typically seeing you for checkups, and those patients cannot get the care that they need because they don't have access to this $500 billion budget.
Yeah, because no doctor, no provider wanna accept Medicaid. Like 2 years ago, year ago, that I accept the Medicaid program and I put an interview. The first thing the doctor told me is, "Oh, I don't wanna deal with the Medicaid. I don't wanna take Medicaid. If you give me Medicaid patient, I'm not going to work for you." You see, nobody want to deal with them. They have such a huge bureaucratic, and they get you on a nip picking. They they some petty stuff. I had an audit by Department of Social Services like maybe 13 years ago. I remember, let's say, we took the periapical X-ray on tooth number 30 and 31, for example. The tooth, let's say we remove it, was number 31, but when we bill the insurance, or we bill the Medicaid on tooth number 30. Okay, so they had the AI too. They run that AI system and said, oh, that radiograph was non-medically necessary. Why
Mm.
non-medically necessary? Because you bill for periapical number 30, but you remove those number 31. You see, this is their way of understanding of dentistry. It is. They go very narrow focus. You said, oh, you bill number 30 periapical, you take 31. Why you did that? Well, I said, okay, so 31, you can see it on that x-ray too. But You see what I mean? This is the way they go after provider. They extrapolate it. They take a sample, like they take like 100 sample of the patient, and then they extrapolate in it for a universal number. So the number is going to end up to be for those petty, stupid, you call it mistakes. I don't think even is a mistakes. You end up to pay hundreds of thousands dollars.
This is exactly what I'm hearing with my dad. So you're telling me that we have definitely over a $500 billion budget for patients across the United States, at least 330 million people who need access to this Medicaid budget, but they cannot access it because Medicaid makes it too hard for doctors to actually accept Medicaid because of the low insurance reimbursements and because of all the regulatory requirements where if you make one
Correct.
mistake as an overburdened in-debt doctor, you can be fined hundreds of thousands of dollars. So we need to focus on the American people and their health. It's crazy how many people are probably suffering every single day because they don't have access to Medicaid. So let me ask you this, Doc, and because I know we're about to wrap up. After 20 years as a dentist, more than 20 years as a dentist, you're risking everything to expose this. What's the one thing that you want every American to know about dental insurance?
Well, first of all, I want to have a public awareness. In terms of the commercial dental insurance, they call themselves insurance. First of all, they not insurance, they are dental coupon or they are coupon. Because dental insurance, they give you $1,000, $1,500 a year, okay? The patient, they think they have an insurance. Some of the patients are in the, not some of them, most of them, they have that misconception because they don't have a dental insurance, they cannot receive dental treatment. I have patients, they say, oh, I'm going to get my insurance, and then I wanted to get my treatment. They don't realize that even they get the insurance, still the insurance is not going to pay the provider. They have so many restriction on their policies to make delay. They get the insurance. They have 3 months waiting period. They all don't know about it. I had a patient had Delta Dental, and they give him $1,000 a year, and I asked him how much he pays for premium, and he said he pays $83 premium every month. So why you want to get an insurance, pay $83 a month, and they give you maybe $1,000? This is insane. This is like a joke. They play because a lot of American people, unfortunately, they are too naive, and these insurance company, they take advantage of that. The people are naive. They tell them insurance, this is not insurance. A state on Connecticut, through the access care, they provide insurance company, insurance, dental insurance to the people that is only until age 26. So a
Mm,
patient came to us and we checked the insurance, okay, and the insurance was active. 73 years old. We did full mouth extraction, okay. The
mm,
computer system told us, oh, they have 100% coverage, okay. We did full mouth x-ray extraction. We insert immediate denture, and we thought the insurance company going to pay because everything it says on the insurance breakdown cover 100% through access care. Then when we bill the insurance company, they send us and said, oh, this insurance only for pediatric coverage. So why even you give pediatric coverage to 73 years old patient? The patient thought has insurance. We thought had a insurance. But guess what? Yeah, you have insurance. You're 73 years old. Still we give you, but you have pediatric coverage. I mean, this is deception. Put it that way. There is no reason to fool that patient. There is no reason to, and then when the patient get billed for a couple of $1,000, of course, everybody pointed finger to each other. The patient say, "Oh, you should check." I tell my front desk person, "Oh, why you didn't check?" Say, "No, doc, I checked." They make things so confusing, so convoluted, and they create wedges between us and our patients.
Mm. Doc, thank you so much for coming on and sharing this. I think the ability to actually share your story and what you've experienced, specifically in Connecticut, and sharing these facts that you've seen head on is going to be super, super helpful for people to see. My final question for you is, what do you think is going to need to happen in the next 5 to 10 years for us to change the American dental insurance system from your experience?
Well, the only thing I can do, I don't know what need to be changed because I'm not in any Congress or Senate or anything. I think the changes need obviously happen on the legislation level. But in my world, the only thing I can do, which I'm doing, and thank you for giving me the opportunity to make the public awareness. That's the only thing on my
Mm,
hand I can do it. If
mm.
I was on the shoe of President Trump, then that would be a different story. But I can do what I can do.
Well, Doc, keep going because that's how I found you, and more people are going to find you and resonate with your story and your message. So I really appreciate you coming on and sharing and keep fighting the good fight because it's people like you who speak up that actually make change. So,
Thank
um,
you for giving me the opportunity. I really appreciate it.
thank you. And where can people find you, Doc? If they want to reach out to you about this topic or anything else, where can they find you?
Follow me on my LinkedIn.
Perfect. Dr. Abbas Mohammadi on LinkedIn. Great.
Thank you so much. Thank you for having me. Thank you.